My name is Carolina Melendez from the Master in Organizational Psychology, and today I'm going to present about aptitude tests at preschool level. Testing and assessing in education. Test and assessment in educational settings allow the teachers to follow their students' progress throughout their time in school. When seen from the student's perspective, assessments can usually be seen as an instrument to evaluate how well they have learned the contents and knowledge shared. When seen from the teacher's perspective, assessments also work as a tool to evaluate and support a student's learning skills and also to detect possible areas of difficulty that need improvement. Bloom described assessments and testing in educational settings as practices of mastery learning. Let's define what's an aptitude test. Aptitude tests tend to focus on informal learning and life experiences, also known as prognostic tests, are usually applied to make predictions. Some aptitude tests have been used to measure readiness to enter a preschool program, an elementary school, successfully complete a challenging course in secondary school, and successfully complete college or graduate level work. At preschool level, aptitude tests are usually known as readiness tests, making reference to physical factors, personality, and other elements considered to be important for children to be ready to learn. Aptitude tests at preschool level. The first 5 years of life, it is a time of profound change. Basic reflex develop and the child passes a number of sensory motor milestones. Assessments at this level allow to observe, document, and determine if the child is developing according to the expectations for the age in cognitive, social, and emotional aspects, and also to detect possible problems and difficulties. Laws exist requiring the assessment of children at preschool level. It is mandatory to assess children with signs of a physical or mental disability in order to provide the special education and resources that they may need. Detecting developmental, emotional, and behavioral difficulties early increases the chances of successful intervention. Assessments at preschool level allow and support early intervention. At this age, assessments play different and crucial roles. Preschool assessment takes place for many reasons: screening, diagnosis, placement decisions, and remediation of problems. Other authors refer to children assessment as one of the vital components of a high-quality education, since assessments support children development. The most common instruments applied at preschool level include checklists, interviews, portfolios, and role-playing. Checklist. The term checklist refers to a type of questionnaire where the absence or presence of a behavior, characteristic, or event, among others, is marked. Checklists must be applied by professionals. In preschool settings, for teachers or psychologists, for example. For an observer, like the parents of the child, or, depending on the age and situation, by the person being assessed. The use of checklists and rating scales allows the detection of children at risk, meaning children not ready for first grade. The most commonly used checklists in children are the Child Behavior Checklist, the Conners Rating Scale, and the Behavior Assessment System for Children. The Child Behavior Checklist. The Child Behavior Checklist is a standardized instrument where parents are asked to complete a questionnaire related to the children's behavior, emotional and social problems. This test has different versions. The one appropriate to assess children at preschool level was designed to evaluate children from 1.5 to 5 years old and can be completed in only 10 minutes. The test does not require a specific environment to be applied and can be completed at home and is also available in 58 languages. The test is composed of 100 items. 99 are closed items and 1 is an open-ended question. The respondent is requested to rate each item based on the preceding 2 months, and the questions are presented with a scale of from 0 to 2, where 0 makes reference to items that are not true for the child, 1 when the item is sometimes true, and 2 referring to items that are very true for the child. The test is composed of an 8-syndrome structure: anxious, depressed, withdrawn, sleep problems, somatic problems, aggressive behavior, and destructive behavior. If the child being assessed attends to a school, the teacher can be also asked to complete a questionnaire that is composed of very similar questions. The caregiver teacher report form that substitutes 17 items pertinent to family situations for items specific to group situations. The child behavior checklist requests supplementary information about the health of the child. The caregiver teacher report form requests information about kind of a daycare and the role of the respondent in relation to the child, including how well the respondent knows the child and in which context the child is evaluated. The Connors Rating Scale Revised. The Connors Rating Scale Revised is a test designed to assess behavioral problems through reports obtained from parents and teachers. The test is presented in a short format, and its main goal is to assess attention deficit hyperactivity disorder and other behavioral problems in ages 3 to 17. This assessment comes in different versions depending on the age being measured, and each version comes with 2 types of test, a short and a long version, and also includes a teacher and a parent version. Independently of the version being used, the purpose of this checklist is to measure hyperactivity in children, have a perspective of a child's behavior based on reports made by people who interact with the child, and develop the best plan to treat the child and set the beginning of therapy and medication if needed. One of the limitations of this assessment is the possibility of diagnosing a child incorrectly. The literature suggests that this assessment can be more effective when applied along with other instruments. The Behavior Assessment System for Children. The Behavior Assessment Children for Children is a multidimensional and norm reference test based on parent and teacher ratings that allows the identification of possible difficulties. This tool that provides information about a child's behavior and emotions consists of rating scales and forms, such as the parent rating scales, the teacher rating scales, the self-report of personality, the student observation system, and the structured developmental history. The teacher rating scales measure adaptive and problem behaviors in the preschool or school settings, and the parent rating scales measure both adaptive and problem behaviors in the community and home setting. The behavior assessment system for children may be used from ages 2 to 25. Behaviors are scored as never, often, sometimes, and almost always. The behavior assessment system for children is designed for use by schools, mental health clinics, pediatric clinics, communities, and researchers to screen for a variety of behavioral and emotional disorders that can lead to adjustment problems. Psychological test. When children are turning 2, conceptual and language skills are developing even more, and tests developed for adults are not appropriate to assess children at this age. Their attention is short and the materials need to be colorful and engaging. Data obtained through intelligent tests have been proven to be effective in order to detect developmental disabilities and deficits. Infant tests can also be applied in research, and intelligence tests play different roles at preschool age, such as screening and measuring educational outcomes, for example. The great value and most important function of tests at preschool level is the identification of children who are in a very low range of functioning and in need of intervention. The most commonly applied tests are the Wechsler Preschool and Primary Scale of Intelligence and the Early Stanford Binet Scale. The Wechsler Preschool and Primary Scale of Intelligence is an intelligence test designed for children ages 2 years 6 months to 7 years 3 months. The purposes of these tests are related to measure general cognitive functioning, guide treatment program development, and make placement decisions in clinical and educational settings, and also provide clinical information for neuropsychological evaluation and research. It provides subtests and composite scores that represent intellectual functioning in verbal and spatial domains. From the original test, 5 subtests compose the version for children, including the receptive vocabulary, block design, information, objective assembly, and picture naming. This test is child-friendly, including colorful and interesting material for children. The Early Stanford Binet Scale. The Early Stanford Binet Scale is an individually administered intelligence test for children aged 2 to 5. The test includes a test observation checklist for documenting behavior during testing. These tests can be used to measure intellectual deficiencies, delays, and disabilities, developmental delays in cognitive and language domains, plan intervention including individual family plans and individual education plans, and refer children for more extensive pre-academic and neuropsychological evaluations. It's composed of 7 scales: the non-verbal fluid reasoning, verbal knowledge, fluid knowledge, quantitative reasoning, visual spatial processing, and working memory. The test includes child-friendly materials with toys, manipulatives, and brightly colored illustrations to help engage young children. Let's talk about some of the ethical, cultural, and societal issues of assessing young children. One of the issues of applying and develop assessment at preschool level is the fact that the younger the child, the more difficult it is to obtain valid assessments. Assessments for young children cannot be the same as other type of assessments since they don't learn in the same way. They construct knowledge in experiential, interactive, concrete, and hands-on ways rather than through abstract reasoning and paper and pencil activities alone. To learn, children need to manipulate, to touch the objects, listen, sing, interact with the environment. Another concern expressed by the authors are related to equity concerns. Aptitude tests at preschool level are influenced by past opportunity to learn. A disproportionate number of poor and minority children are identified as unready and are excluded from school when they most need it. The National Association for the Education of Young Children described in the guidelines for assessments in young children that these should bring benefits for children or data should not be collected at all. And another important point is that assessments should not make children feel anxious. It should not threaten their self-esteem or make them feel they have failed. Thank you for watching.